Welcome back to Tip TV Health, joined by Dr Charlie from Harley, a man who's got more letters after his name than in his name. Right, let's talk travel health, okay? I've got a old boy, a really good mate of mine. He's terminally ill, wants to go to New York. Nobody will insure him.
Yeah, this is a common problem. I used to work for the insurance industry, and I also used to do medical evacuation, so we saw both sides of that. You know, if I were ill, I would want to be abroad, frankly, and I'd want to see my last days out not having chemotherapy on a beach. I've chosen my beach. It's a beach in Ibiza. But obviously there's the getting there safely and not dying in a plane. If you die in a plane over airspace, it's incredibly complicated, and you're not dead until you land, because no one wants to declare. Is that right? No one wants to declare a British body dead over Greek airspace, and you know what I mean? It gets hellishly complicated. So I think that's the issue. So if he could find somebody who could accompany him, the equivalent of a Macmillan nurse, somebody who's doing palliative...
Or the moose?
Yeah, or the moose, palliative care, then he may be able to take the risk of the travel, and you may be able to do it on a non-insured basis, but the problem is that if something goes wrong, the cost will be incredibly high in terms of getting back.
So he goes to New York on £1,000 weekend break.
Yeah.
Okay, he falls ill, he's got no travel insurance, then his bill is suddenly £500,000. Does that mean that they can come after his estate?
Yeah, we've had cases where people have had to sell their houses in the UK, and it's extended beyond the individual to the other members of the family.
So it's gone into the family.
It's very serious, yeah.
Okay, so let me ask you another question, okay? For that £1,000 holiday, is there somewhere that he can pay a 50% premium, or whatever the right number is, to get insured?
It's a really good question, and I don't know the answer at the moment. There are specialist insurers. The same happened, by the way, with HIV when it first came out. Some traditional insurers just said, we're not insuring you.
Yep.
But then specialist insurers, I think Ivan Masso was one of them actually, entered the market with extra premiums to say, we'll cover that risk. Now, I'm not immediately aware of anyone who covers cancer risk when you know you have cancer. Right. But there may be someone in the market who specialises in
Understood. That. Vaccinations.
Yeah.
Okay, serious subject.
Yeah, absolutely.
Should I abide by the rules, or should I take a risk, or how does it work? I don't want to go down my doctor's sit there for 3 hours. Okay.
Well, there are specialist travel clinics, and they, you know, you just book in, turn up, get jabbed, so you don't always have to go to your GP.
Is that reassuringly expensive?
It's reassuringly expensive, but let's understand how it works, right? So the NHS provides some, but not all, travel vaccines anyway. So it will provide you with hepatitis A and typhoid, and usually diphtheria, tetanus and polio, but virtually everything else you would have to pay for anyway. And then on top of that...
So what wouldn't they pay for that I need if I was going to China or Africa?
Very good question. So they wouldn't pay for yellow fever, for example. Okay. So you have to go to a designated yellow fever centre, and there's a website called nathnac.org, nathnac.org, and on that they have a list of the designated yellow fever centres. Now, when you get your yellow fever shot, if it's appropriate for you to have it, that is then valid for 10 years, and you get a special World Health Organisation approved certificate to say you've had it. If you're going to part of Africa where there was a risk of rabies, for example, again, that's not part of your GP's remit to cover you for that.
Okay. So I'm doing a world tour. I'm going away for a month. I'm going to 17 countries. Okay. Where do I go to actually find out what I should have for those 17 countries?
Very good question. So the website I mentioned, NathNac, does have an associated section that gives you or your doctor some advice in that space. There's also a Scottish website called Fit for Travel, which does that as well. And then, as I said before, specialist travel clinics do this every day, all day. So what they'll tell you is the minimum requirements are to have the Hep A, protect yourself against typhoid, which is a sort of muck-to-mouth transmission of a disease. You don't want to get tetanus, because that you could be walking on a beach, your foot gets pricked and blood goes in, and then you can die from that complication.
Right.
And then depending on where else you're going, there may be some specialist vaccines associated.
Am I breaking the law by not having the injections?
Funnily enough, you're not. The only one that is properly controlled at the moment is yellow fever. And what WHO WHO have said that if you go to certain countries, you should have the yellow fever vaccine at least 10 days before you go. And the reason is they don't want yellow fever to spread around the world.
Right.
So there are countries where if you can't show a yellow fever certificate, a chap in either a clean pair of white coat or a dirty white coat will jab you.
Really?
That is part of the deal, because you're now trying to enter his country or her country without the shot.
Okay, so in the simplest form, scare me with the downside of having yellow fever to make sure that I have that jab ahead of the trip.
The reason yellow fever is called yellow fever is partly because it made you yellow, it damaged the liver, and it has two types of effects. One is neurological and one is visceral. The neurological one leaves you with the equivalent of stroke or brain damage. The visceral one causes organ damage, and both ultimately can lead to death. Yellow fever did not originally exist in Africa. In South America. It was brought there by the slave trade. Yellow fever currently does not exist in India, but unless we keep it under control, it could get into India because they have the appropriate type of mosquito, and that would be a global disaster.
So if there's one country in the world at the moment you would not visit for all of these horrible diseases, where would you not currently go?
Oh, but you see, I'm a born traveller. I've been to more than 75 countries,
Have you really?
and
Well,
I want to go to more.
Right.
So there's nothing that could put me off going anywhere. The simple advice is to check the facts, be careful about what you eat, be careful about what you drink, keep appropriately well hydrated.
So that's fresh water. In terms of eating, you wouldn't eat what?
You know, I don't mind street food, but it's street food that I know is cooked hot and is locally done. I wouldn't have something warm. And equally, I could be in a 5-star hotel, but I don't know how long that salad's been out there. I don't know whether the chap who put the salad in there managed to wash his hands before he put it there. So I think the caution is around, is the food hot enough to be safe? If it's something that you can peel, are you happy that you can peel it and that it hasn't been dipped in something prior to you peeling it? So there's a common sense element. But by the way, a lot of people get diarrhea. About 50% of travellers are likely to get the squits from their travelling.
Okay, so what concerns me is we all like a kebab when we've had a few beers, right? They now do a chicken kebab that's on the skewer, and that looked to me.
Are you sure it's chicken?
Well, apart from anything else, all right, okay, something that's sat there, okay, goes hot, then goes cold, right?
Yeah, that's not good.
That, for me, is the most dangerous thing I could possibly do.
Yeah, absolutely. And what we now see is this disease called E. coli, which is a form of bacteria, and a lot of our chickens have it. And if your chicken goes cold, as you said, and then warm again, then the E. coli can breed. And this particular E. coli can affect the kidneys and can affect the blood system, cause septicemia. Not many people know that Johnny Depp's daughter, when she was in England, actually suffered from that condition, and she was very sick indeed.
Really? Okay, let's take a very quick break and we'll be back. Thank you.